Question 1. When working as an RBT, who is primarily responsible for designing the behavior intervention plan? A. The RBT. B. The client's parent or guardian. C. The supervising BCBA or BCABA. D. The client. Answer: C. The supervising BCBA or BCABA. This question is about the roles and responsibilities within a behavior therapy team. The keyword primarily responsible for designing tells you who creates the overall plan. While RBTs are crucial for carrying out the plan, they do not design it. That is the job of the BCBA, Board Certified Behavior Analyst, or BCABA, Board Certified Assistant Behavior Analyst, who have more advanced training and certification in creating behavior change strategies based on assessment data. The RBT's role is to implement the plan under the supervision of the BCBA/BCABA, collecting data and working directly with the client. Think of it like a doctor, BCBA, diagnosing and creating a treatment plan, and a nurse, RBT, carrying it out. Your BCBA is the expert designer. Question 2. Which of the following is the best example of a measurable and observable behavior? A. Feeling sad. B. Understanding the concept. C. Hitting a toy car on the table. D. Being angry. Answer: C. Hitting a toy car on the table. This question is asking you to identify a behavior that you can clearly see and count. Keywords like measurable and observable are key. Can you see it happening, and can you count it? Feeling sad, understanding, and being angry are internal states or thoughts. You can't directly see or count them. Hitting a toy car, however, is an action you can see and count how many times it happens. When we work on behavior, we need to focus on things we can see and measure reliably. For example, instead of saying the child was angry, you'd say the child threw the toy, observable, 3 times, measurable. Always look for actions you can count. Question 3. What is the purpose of collecting data on a client's behavior? A. To understand the behavior and track progress. B. To judge the client's performance. C. To entertain the client. D. To share with other clients. Answer: A. To understand the behavior and track progress. This question is about why data collection is so important in ABA. The purpose is the main reason we do it. We collect data not to judge or entertain, but to get a clear picture of what is happening with the behavior and to see if our interventions are working over time. Data helps the BCBA make decisions about whether to continue or change the plan. For example, if you're tracking how many times a child asks for a break, the data shows if they are learning to ask for breaks more often or if the behavior is staying the same. Data helps us see if we're making a difference. Question 4. In a discrete trial training, DTT, session, what does the response refer to? A. The consequence provided after the behavior. B. The instruction given by the RBT. C. The client's behavior in reaction to the instruction. D. The item or activity used as a reinforcer. Answer: C. The client's behavior in reaction to the instruction. This question is about understanding the parts of a discrete trial training, DTT, cycle. DTT breaks skills down into small steps. The keyword response in this context refers to what the client does right after the RBT gives an instruction, the discriminative stimulus or SD. For example, if the RBT says, "Touch your nose," SD, the response is the child touching their nose or doing something else. The consequence comes after the response. The instruction is the SD, and the reinforcer is a consequence that strengthens the response. The response is simply the client's action. Question 5. Providing a reinforcer immediately after a desired behavior occurs is important because it helps the client understand A. The instruction. B. What behavior earned the reinforcer. C. How to get the reinforcer next time. D. How to avoid doing the behavior. Answer: B. What behavior earned the reinforcer? This question is about the importance of immediacy when giving reinforcement. The keyword immediately is key here. When you give a reward right after the client does the target behavior, it creates a clear connection in their mind between their action and the good thing that followed. If you wait too long, they might not understand which behavior they did that earned the reward. For instance, if a child cleans up their toys and you give them a sticker 10 minutes later while they are eating a snack, they might think they got the sticker for eating, not for cleaning up. Delivering it right away makes the connection clear. Question 6. What is the term for a consequence that increases the future likelihood of the behavior it follows? A. Punishment. B. Extinction. C. Reinforcement. D. Antecedent. Answer: C. Reinforcement. This question asks about a core principle in ABA, how behavior changes based on what happens afterward. The crucial phrase is increases the future likelihood. If a consequence makes a behavior happen more often in the future, that consequence is called reinforcement. Punishment decreases the future likelihood. Extinction is withholding reinforcement for a previously reinforced behavior. An antecedent happens before the behavior. If a child says cracker and immediately gets a cracker, they are more likely to say cracker in the future. Getting the cracker reinforced the verbal request. Remember, reinforcement makes behavior grow. Question 7. An RBT is working with a client who sometimes screams when asked to clean up toys. The RBT now ignores the screaming and only gives attention and praise when the client quietly puts a toy away. What procedure is the RBT using for the screaming? A. Punishment. B. Reinforcement. C. Extinction. D. Shaping. Answer: C. Extinction. This question describes a common scenario where a challenging behavior, screaming, is being addressed. The key action the RBT takes is ignores the screaming. The screaming was likely happening because it previously resulted in getting attention or avoiding cleanup. By now withholding the reinforcement, attention/escape, that previously maintained the screaming, the RBT is using extinction for that specific behavior. They are reinforcing a different, appropriate behavior, quietly putting a toy away, but the ignoring of the screaming is the extinction part. Think of extinction as cutting off the supply of whatever was feeding the behavior. Question 8. When implementing a behavior plan, what should an RBT do if they are unsure about a specific step or feel uncomfortable with a procedure? A. Skip the procedure and do something else. B. Ask the client what to do. C. Contact their supervising BCBA/BCABA for clarification. D. Figure it out on their own. Answer: C. Contact their supervising BCBA/BCABA for clarification. This question is about ethical and professional conduct for an RBT. The RBT works under supervision, and the supervising BCBA/BCABA is the expert who designed the plan. If you are unsure or uncomfortable, it's vital for the client's safety and the effectiveness of the plan that you get help from your supervisor. You should never skip procedures or try to guess, as this could harm the client or make the intervention ineffective. Reaching out to your supervisor is the correct and professional action to take whenever you have questions or concerns about the treatment plan. Your supervisor is your guide and support system. Question 9. What is the primary purpose of a functional assessment, or functional behavior assessment (FBA? A. To teach the client new skills. B. To determine the function, reason, of a behavior. C. To measure how often a behavior happens. D. To punish inappropriate behavior. Answer: B. To determine the function, reason, of a behavior. This question is about functional assessment, a foundational process in ABA. The word functional is a big clue. A functional assessment is done to understand why a behavior is happening. What is the function or purpose it serves for the client? Does it get them attention, help them escape something they don't like, get them access to an item, or is it automatically reinforcing, feels good? We need to know the why before we can effectively change the behavior. Counting how often it happens is part of the assessment, but the main goal is to figure out the reason behind it. Figuring out the function helps us create the right plan. Question 10. Which of the following is the best example of positive reinforcement? A. Taking away a toy when a child screams, which decreases screaming in the future. B. Giving a child a sticker for saying please, which increases the child saying please in the future. C. Telling a child no loudly when they hit, which decreases hitting in the future. D. Ignoring a child's tantrum, which decreases tantrums in the future. Answer: B. Giving a child a sticker for saying please, which increases the child saying please in the future. This question asks you to identify positive reinforcement. Positive means adding something, and reinforcement means the behavior increases in the future. In option B, something is added, a sticker, and the behavior, saying please, increases. Option A is punishment, taking away something, behavior decreases. Option C is punishment, adding something unpleasant, behavior decreases. Option D is extinction, taking away reinforcement, behavior decreases. Positive reinforcement is giving something good to make a behavior happen more often. Question 11. Which type of discontinuous measurement involves recording whether the behavior occurred at any point during a specific time interval? A. Frequency. B. Duration. C. Partial interval recording. D. Momentary time sampling. Answer: C. Partial interval recording. This question is about different ways to measure behavior over time, specifically discontinuous measurement, where you don't record every single instance. The key phrase is occurred at any point during a specific time interval. With partial interval recording, you look at an interval, e.g., 30 seconds. If the behavior happens for even just 1 second during that interval, you mark it as occurring. Frequency is counting every time the behavior happens. Duration is how long the behavior lasts. Momentary time sampling is if the behavior is happening exactly when the interval ends. Partial interval is about whether it just shows up at all during the time block. Question 12. When teaching a new skill, breaking it down into smaller, manageable steps is called A. Prompting. B. Reinforcement. C. Task analysis. D. Extinction. Answer: C. Task analysis. This question describes a common strategy for teaching complex skills. The phrase breaking it down into smaller, manageable steps is the definition of a task analysis. It's like writing a recipe for a skill. For example, teaching a child to brush their teeth might be broken down into steps like: get toothbrush, put toothpaste on brush, turn on water, wet brush, brush front teeth, brush back teeth, rinse brush, put brush away. Prompting is giving help, reinforcement increases behavior, and extinction decreases behavior. A task analysis is the blueprint for teaching a multi-step skill. Question 13. What is the purpose of using a prompt? A. To prevent the behavior from happening. B. To make sure the client always gets the answer right without thinking. C. To help the client engage in the correct behavior so it can be reinforced. D. To test if the client knows the skill independently. Answer: C. To help the client engage in the correct behavior so it can be reinforced. This question is about prompts, which are forms of assistance. A prompt is a little bit of help we give the client to make sure they can perform the desired behavior after the instruction. This allows us to immediately reinforce the correct response, making it more likely to happen in the future. Prompts are temporary tools. The goal is to fade them out as the client learns. We aren't trying to trick them or prevent the behavior, but rather guide them towards the correct response so they can experience success and reinforcement. Prompts help set the client up for success. Question 14. What should an RBT do if a client engages in a severe challenging behavior that is not in the behavior intervention plan? A. Implement a punishment procedure they think might work. B. Ignore the behavior. C. Contact their supervisor immediately for guidance. D. Try to figure out the function of the behavior on their own. Answer: C. Contact their supervisor immediately for guidance. This question is about handling unexpected and serious situations as an RBT. If a severe behavior occurs that isn't covered in the plan, it means you don't have specific instructions on how to handle it safely and effectively. Your immediate priority is the client's safety and well-being, and you need expert guidance from your supervisor, BCBA/BCABA, on how to respond. You should never make up a plan or procedure on the spot, especially for severe behaviors. Your supervisor has the expertise to tell you what to do in that specific situation. Always call your supervisor when something serious and new happens. Question 15. In which situation would you use duration recording? A. To count how many times a child claps their hands. B. To measure how long a child stays engaged with a toy. C. To see if a child started screaming at any point during a minute. D. To check if a child was sitting down at the exact moment the timer beeped. Answer: B. To measure how long a child stays engaged with a toy. This question asks you to choose the best situation for using duration recording. Duration measures how long a behavior lasts. Option B, how long a child stays engaged, directly asks for the length of time, making duration recording appropriate. Option A, requires counting, frequency. Option C, requires whether it happened at any point, partial interval. Option D, requires if it happened at a specific moment, momentary time sampling. Use duration when you need to know how long a behavior is happening, like how long a tantrum lasts or how long someone reads. Question 16. What is the term for a decrease in the frequency of a behavior when reinforcement is no longer provided for that behavior? A. Positive reinforcement. B. Punishment. C. Generalization. D. Extinction. Answer: D. Extinction. This question describes the outcome of stopping reinforcement for a behavior. The key phrase is decrease in the frequency, when reinforcement is no longer provided. When you stop giving whatever was keeping a behavior going, that behavior is likely to decrease or stop over time. This process is called extinction. Positive reinforcement increases behavior by adding something, punishment decreases behavior, and generalization is about the behavior happening in new situations. Extinction is the process of making a behavior disappear by removing its source of fuel, reinforcement. Question 17. What is the difference between a primary reinforcer and a secondary reinforcer? A. Primary reinforcers are more effective than secondary reinforcers. B. Primary reinforcers are unlearned, like food, while secondary reinforcers are learned, like praise or stickers. C. Primary reinforcers are used first, then secondary reinforcers are introduced. D. Primary reinforcers are used for young children, and secondary reinforcers are used for older children. Answer B. Primary reinforcers are unlearned, like food, while secondary reinforcers are learned, like praise or stickers. This question is about different types of reinforcers. Primary reinforcers are naturally reinforcing. They meet basic needs and don't require learning to be reinforcing, like food, water, warmth, sleep. Secondary reinforcers, also called conditioned reinforcers, become reinforcing because they have been paired with primary reinforcers or other strong secondary reinforcers, like money, praise, tokens, stickers. For a child, food is primary, but praise is secondary because they learn that praise is often associated with good things. Primary is natural, secondary is learned. Question 18. Which behavior measurement method is best for behaviors that occur at a high rate? A. Duration. B. Frequency. C. Partial interval recording. D. Momentary time sampling. Answer C. Partial interval recording. This question asks about measuring behaviors that happen very often. When a behavior happens at a high rate, counting every single instance, frequency, might be difficult or impossible to do accurately, especially while also trying to work with the client. Discontinuous methods are often used for high-rate behaviors. Duration measures how long, not how often. Momentary time sampling is good for behaviors that happen for extended periods or are easily observable right at the end of an interval. Partial interval recording, where you just mark if it happened at all in the interval, is a practical way to get an estimate of how often a high-rate behavior is occurring without needing to count every single time. It gives you a good estimate for busy behaviors. Question 19. What is the ethical responsibility of an RBT regarding client confidentiality? A. To share client information with anyone who asks. B. To discuss client cases with family and friends for advice. C. To keep all client information private and only discuss it with authorized individuals, like the supervisor. D. To post about client progress on social media to celebrate successes. Answer C. To keep all client information private and only discuss it with authorized individuals, like the supervisor. This question is about a crucial ethical standard for RBTs, client confidentiality. Confidentiality means protecting the client's private information. You are ethically required to keep everything you learn about a client confidential and only share it with people directly involved in their treatment who have a right to know, primarily your supervisor, and possibly other team members under supervision. Discussing cases with friends/family or sharing on social media is a major ethical violation. Your client's privacy is essential and must be strictly protected. Question 20. What is the purpose of a graph in ABA? A. To make the data look complicated. B. To visually show the data and progress over time. C. To hide information about the client. D. To replace the need for collecting data. Answer B. To visually show the data and progress over time. This question is about why we use graphs in ABA. Graphs are a way to take all the numbers you collected and turn them into a picture that's easy to understand. They help us see trends. Is the behavior increasing, decreasing, or staying the same? This visual representation helps the BCBA quickly analyze progress and make informed decisions about the intervention plan. Graphs don't make data complicated, they make it clearer. They are a tool for analyzing the data we collect, not replacing it. Graphs tell the story of the data. Question 21. When a client performs a skill correctly without any help or prompts, this is called A. Prompted response. B. Incorrect response. C. Independent response. D. Prompt fading. Answer C. Independent response. This question is about classifying client responses. The key phrase is correctly without any help or prompts. When the client can do the target behavior correctly all by themselves after the instruction, that is called an independent response. A prompted response is when they need help. An incorrect response is when they do the wrong thing or nothing. Prompt fading is the process of reducing prompts over time. An independent response is the goal. It means the client has learned the skill. Question 22. What is the primary role of an RBT in the service delivery system? A. To conduct assessments and design treatment plans. B. To provide direct behavior analytic services under supervision. C. To supervise other RBTs. D. To provide parent training independently. Answer B. To provide direct behavior analytic services under supervision. This question clarifies the main job of an RBT. The primary role of an RBT is to work directly with the client, implementing the behavior plan that was designed by their supervisor, BCBA/BCABA. They provide the hands-on therapy, collect data, and work on skills and behaviors. Designing plans and supervising others are roles for BCBAs/BCABAs. RBTs provide the direct service, but always under the guidance of a supervisor. You are the boots on the ground, carrying out the plan. Question 23. What is a discriminative stimulus, SD? A. A consequence that follows a behavior. B. A signal that tells the client what behavior is expected and will be reinforced. C. An event that happens after a behavior and makes it less likely. D. A behavior that is being targeted for change. Answer B. A signal that tells the client what behavior is expected and will be reinforced. This question is about the antecedent part of the ABC, antecedent behavior consequence, model. An SD is something in the environment that signals that a specific behavior will likely be reinforced if it occurs. It's like a cue or an instruction. For example, if you say touch head, SD, and the child touches their head and gets praise, they learn that saying touch head means touching your head will be reinforced. The SD sets the occasion for a specific response because that response has been reinforced in its presence before. It's the go signal for a particular behavior. Question 24. When reinforcing a behavior, giving the reinforcer only some of the times the behavior occurs, not every time, is called A. Continuous reinforcement. B. Extinction. C. Intermittent reinforcement. D. Punishment. Answer C. Intermittent reinforcement. This question is about schedules of reinforcement. When you reinforce a behavior every single time it happens, that's continuous reinforcement, often used when first teaching a skill. When you reinforce it sometimes but not always, that's intermittent reinforcement. Intermittent schedules make behaviors more resistant to extinction, harder to stop. Extinction is withholding reinforcement, and punishment decreases behavior. Think of a vending machine, continuous reinforcement, versus a slot machine, intermittent reinforcement. Which one is harder to stop trying? Intermittent schedules build persistence. Question 25. What is shaping? A. Reinforcing only the exact target behavior every time it occurs. B. Gradually reinforcing closer and closer approximations to a target behavior. C. Providing a prompt to help the client perform a behavior. D. Teaching a skill by breaking it into smaller steps. Answer B. Gradually reinforcing closer and closer approximations to a target behavior. This question asks about shaping, a technique used to teach new behaviors that the client doesn't do yet. Shaping involves starting by reinforcing any behavior that is close to the target behavior, and then gradually only reinforcing behaviors that are successively closer to the final goal behavior. For example, to teach a child to say ball, you might first reinforce any sound they make that starts with B, then only BA, then only ball. You are shaping the behavior towards the final goal by rewarding small improvements along the way. It's about reinforcing baby steps towards the goal. Question 26. Which dimension of behavior refers to the physical space the behavior occupies or the distance it travels? A. Frequency. B. Duration. C. Topography. D. Intensity. Answer: C. Topography. This question asks about one of the measurable dimensions of behavior. Topography refers to the form or physical movements involved in the behavior, what it looks like. Think of describing the behavior in detail. How big are the movements? What muscles are used? Where does it happen in space? Frequency is how often it happens, duration is how long, and intensity is how strong or forceful it is. Describing what the behavior looks like is describing its topography. For example, the topography of hitting might include raising the hand overhead, forming a fist, and swinging forward. Question 27. An RBT is teaching a child to identify colors. The RBT says touch red and the child touches the red card. The RBT gives praise. What is the praise in this scenario? A. The discriminative stimulus, SD. B. The response. C. The consequence. D. The prompt. Answer: C. The consequence. This question is about the ABC model again, antecedent behavior consequence. The RBT saying touch red is the antecedent, A. The child touching the red card is the behavior or response, B. The praise given after the behavior is the consequence, C. Consequences happen after the behavior and affect its future likelihood. Since praise is likely to make the child touch the red card again when asked, it's also a reinforcer, which is a type of consequence. The consequence is what happens right after the behavior. Question 28. What is continuous measurement? A. Recording behavior only at the end of an interval. B. Recording behavior at any point during an interval. C. Recording every instance of a behavior. D. Recording the duration of a behavior. Answer: C. Recording every instance of a behavior. This question asks about continuous measurement methods. Continuous means ongoing, recording every time the behavior occurs. Frequency, counting each instance, and duration, measuring the length of each instance, are types of continuous measurement. Partial interval and momentary time sampling are discontinuous because you're only recording within or at specific parts of intervals, not every single occurrence. Continuous measurement aims for a complete count or timing of the behavior. Question 29. When should an RBT update the data they are collecting? A. Only at the end of the session. B. Only if the behavior happened a lot. C. As soon as possible after the behavior occurs. D. Whenever they remember. Answer: C. As soon as possible after the behavior occurs. This question is about accurate data collection procedures. The key is as soon as possible. To ensure the data is accurate and reliable, you should record it immediately or very soon after the behavior happens. Waiting until the end of the session or trying to remember later increases the chance of errors or forgetting details. Prompt data entry helps maintain the integrity of the information needed to make decisions about the client's progress. Don't wait too long to write it down. Question 30. What is generalization? A. The client performs the behavior only in the specific therapy setting. B. The client performs the behavior in different settings, with different people, or using different materials. C. The client stops performing the behavior because it is no longer reinforced. D. The client learns to discriminate between different instructions. Answer: B. The client performs the behavior in different settings, with different people, or using different materials. This question is about generalization, which is a crucial goal in ABA. Generalization means that the skill or behavior the client learned isn't just happening in the exact situation it was taught. It happens across different people, with mom, dad, teacher, in different places, home, school, store, using different materials, identifying a red ball and a red car, or at different times. We want skills to be useful in the real world. Option A describes the opposite of generalization. Generalization means the learning spreads out. Question 31. What is the ethical guideline regarding maintaining professional boundaries with clients and their families? A. It's okay to become close personal friends and socialize outside of therapy. B. RBTs should avoid dual relationships that could impair objectivity or risk exploitation. C. RBTs should accept gifts from clients and families as a sign of gratitude. D. It's fine to babysit for the client outside of therapy hours. Answer: B. RBTs should avoid dual relationships that could impair objectivity or risk exploitation. This question addresses professional boundaries, a critical ethical responsibility. A dual relationship is when you have more than one type of relationship with a client or family, e.g., RBT and friend, RBT and babysitter. This can make it hard to stay objective in your professional role and could potentially exploit the power imbalance. RBTs must maintain professional boundaries to ensure they are always acting in the client's best interest without conflicts of interest. Accepting gifts or babysitting can blur these lines. Keep your professional role clear and separate. Question 32. Which term describes a prompt that involves physically guiding the client's body to perform the desired behavior? A. Vocal prompt. B. Gestural prompt. C. Full physical prompt. D. Model prompt. Answer: C. Full physical prompt. This question asks about different types of prompts. A full physical prompt is when you physically assist the client through the entire movement of the target behavior. For example, putting your hands over the client's hands to help them complete a puzzle piece or guiding their hand to touch their nose. A vocal prompt is saying something, a gestural prompt is pointing or gesturing, and a model prompt is showing them how to do it. Full physical is the most intrusive prompt and involves direct physical guidance. Question 33. When a behavior is reinforced on a variable ratio, VR, schedule, when is reinforcement delivered? A. After a fixed number of responses. B. After an average number of responses. C. After a fixed amount of time. D. After a variable amount of time. Answer: B. After an average number of responses. This question is about intermittent schedules of reinforcement, specifically VR schedules. A ratio schedule is based on the number of responses. A variable schedule means the requirement changes each time. So, a variable ratio, VR, schedule delivers reinforcement after an average number of responses. For example, a VR5 schedule means reinforcement happens on average after 5 responses, but it might be after 3 responses, then 7, then 4, then 6. Slot machines are a real-world example. You don't know exactly how many pulls it will take to win, but it's based on the number of pulls. Variable ratio keeps people going because they never know which response will pay off. Question 34. What is behavioral momentum? A. The tendency of a behavior to continue once it has started. B. presenting a series of easy-to-follow instructions before presenting a more difficult instruction. C. The speed at which a client performs a behavior. D. Reinforcing every instance of a behavior. Answer: B. Presenting a series of easy-to-follow instructions before presenting a more difficult instruction. This question describes the technique of behavioral momentum. It's like building up momentum by getting the client to comply with several instructions they usually follow easily, high-probability requests or high-P requests. This increases the likelihood that they will also comply with a harder instruction, low-probability request or low-P request, that follows immediately after. For example, asking clap your hands, easy, touch your head, easy, stand up, easy, then clean up toys, harder. It uses compliance with easy tasks to increase compliance with harder ones. Get M saying yes. Question 35. What is the term for a consequence that decreases the future likelihood of the behavior it follows? A. Reinforcement. B. Extinction. C. Discrimination. D. Punishment. Answer: D. Punishment. This question asks about another core principle, how behavior changes based on decreasing its future occurrence. The key phrase is decreases the future likelihood. If a consequence makes a behavior happen less often in the future, that consequence is called punishment. Reinforcement increases behavior, extinction is withholding reinforcement to decrease behavior, and discrimination is learning to respond differently in different situations. Punishment is about making a behavior happen less often. Question 36. When collecting data using momentary time sampling, the behavior is recorded as occurring if it is happening. A. At any point during the interval. B. For the entire duration of the interval. C. Exactly at the moment the interval ends. D. A certain number of times during the interval. Answer: C. Exactly at the moment the interval ends. This question describes momentary time sampling, MTS, a type of discontinuous measurement. The key is momentary, you only check at one specific moment in time. With MTS, you set a timer for intervals, and when the timer beeps, the moment the interval ends, you look up and record if the behavior is happening right then. It gives you an estimate of how often a behavior is occurring. Partial interval is if it happens any time in the interval, and whole interval is if it happens for the whole interval. Momentary means you check at the snapshot in time when the interval finishes. Question 37. What is the purpose of a preference assessment? A. To determine the function of a behavior. B. To identify potential reinforcers. C. To measure the duration of a behavior. D. To teach a new skill. Answer: B. To identify potential reinforcers. This question is about preference assessments, a vital first step before starting many interventions. The purpose of a preference assessment is to figure out what items, activities, or social interactions a client likes or prefers. Things a client prefers are likely candidates to be used as reinforcers to motivate them during learning and behavior change. It's not about why a behavior happens, function, measuring how long, duration, or teaching skills. It's about discovering what might work as a reward. Find out what they like to motivate them. Question 38. What is discrimination in the context of ABA? A. Performing a behavior in many different settings. B. Learning to respond differently in the presence of different stimuli. C. A decrease in behavior due to lack of reinforcement. D. Teaching a skill by breaking it into steps. Answer: B. Learning to respond differently in the presence of different stimuli. This question defines discrimination, which is the opposite of generalization. Discrimination is when a client learns to perform a behavior in the presence of one specific stimulus, the SD, but not in the presence of other, similar stimuli, called S delta or S delta. For example, a child learns to say car when shown a picture of a car, SD, but not when shown a picture of a truck, S delta. They are discriminating between the two pictures. Generalization is doing the behavior in many situations. Discrimination is doing it only in the right one. It's about knowing when and when not to do something. Question 39. What is the definition of a conditioned reinforcer? A. A reinforcer that is effective the first time it is presented. B. A reinforcer that has been paired with other reinforcers and has become reinforcing through learning. C. A reinforcer that is naturally reinforcing without any prior learning. D. A reinforcer that is delivered only after an average number of responses. Answer: B. A reinforcer that has been paired with other reinforcers and has become reinforcing through learning. This question asks for the definition of a conditioned reinforcer, also called a secondary reinforcer. These are things that weren't naturally reinforcing but became reinforcing because they were associated with other reinforcers, often primary ones. Praise, stickers, tokens, and money are all examples. We learn to value them because they are linked to things we naturally like. Primary reinforcers, like food, are naturally reinforcing. Conditioned reinforcers get their power through association and learning. Question 40. Which of the following is a clear, objective, and complete definition of aggression? A. The client was angry and mean to others. B. The client intentionally hurt someone's feelings. C. Any instance of the client hitting, kicking, or biting another person. D. The client displayed challenging behavior towards peers. Answer: C. Any instance of the client hitting, kicking, or biting another person. This question is about writing good behavior definitions. A behavior definition must be clear, objective, and complete so that anyone observing the behavior knows exactly what to look for and can agree on whether it happened. Option C. List specific, observable actions: hitting, kicking, biting. Options A, B, and D. Use subjective terms: angry, mean, intentionally hurt feelings, challenging behavior, that can't be directly observed or measured reliably. A good definition helps everyone agree on what the behavior is. Question 41. What is a mand? A. Asking for something you want. B. Naming an item or action. C. Copying what someone says. D. Answering a question. Answer: A. Asking for something you want. This question is about verbal operants, which are different functions of language. A mand is a request. You ask for what you want or need, and the reinforcement is getting that item or information. For example, saying juice because you're thirsty and want juice, or saying open because you want the door opened. Naming is a tact. Copying is an echoic, and answering a question can be an intraverbal. Mands are all about requesting and getting what you ask for. Question 42. What is an echoic? A. Asking for something you want. B. Naming an item or action. C. Copying what someone says. D. Answering a question. Answer: C. Copying what someone says. This question is about another verbal operant, the echoic. An echoic is repeating or copying something someone else says. For example, if the RBT says say cookie and the child says cookie. The reinforcement for an echoic is typically social praise or continuing the interaction. Asking for something is a mand, naming is a tact, and answering a question can be an intraverbal. Echoics are about repeating sounds or words you hear. Question 43. What is a tact? A. Asking for something you want. B. naming an item, action, or property in the environment. C. Copying what someone says. D. Answering a question. Answer B. Naming an item, action, or property in the environment. This question asks about the tact, another verbal operant. A tact is labeling or naming something you see, hear, smell, taste, or feel in the environment. For example, seeing a dog and saying dog, seeing someone running and saying running, or feeling soft fur and saying soft. The reinforcement is usually social praise or acknowledgement. Yes, that's a dog. Mands are requests, echoics are copying, and answering questions can be intraverbals. Tacts are about commenting on or labeling the world around you. Question 44. What is an intraverbal? A. Asking for something you want. B. Naming an item or action. C. Copying what someone says. D. Answering a question or filling in a blank in a conversation. Answer D. Answering a question or filling in a blank in a conversation. This question defines the intraverbal, another verbal operant. An intraverbal is a verbal response that is controlled by another person's verbal behavior, and there is no point-to-point similarity. It's essentially conversational behavior. Examples include answering questions, "What's your name?" filling in blanks, "Twinkle, twinkle little," or continuing a sentence, "Ready, set." The reinforcement is social, like keeping the conversation going. Mands are requests, tacts are labeling, and echoics are repeating. Intraverbals are like verbal back and forth. Question 45. When you are teaching a client to wash their hands, you start by doing most of the steps for them and have them do the last step, drying hands, independently. Once they master that, you have them do the last two steps, and so on. What type of chaining is this? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer B. Backward chaining. This question describes a specific way of teaching a multi-step skill using chaining. The key is that you are teaching the steps in reverse order, starting with the last step. In backward chaining, the RBT completes all steps except the final one, and the client learns to do just that last step. Once mastered, the RBT completes all but the last two steps, and the client learns to do those, and so on, until the client can do the entire task from beginning to end. This is often effective because the completion of the final step immediately results in reinforcement, e.g., hands are clean. Forward chaining starts with the first step, and total task teaches all steps at once with support. Backward chaining teaches from the end to the beginning. Question 46. What is negative reinforcement? A. Taking away something pleasant, which decreases the future likelihood of the behavior. B. Giving something unpleasant, which decreases the future likelihood of the behavior. C. Taking away something unpleasant, which increases the future likelihood of the behavior. D. Giving something pleasant, which increases the future likelihood of the behavior. Answer C. Taking away something unpleasant, which increases the future likelihood of the behavior. This question defines negative reinforcement. Negative means taking something away, and reinforcement means the behavior increases in the future. So, negative reinforcement is when a behavior occurs, and something unpleasant is removed or avoided, making that behavior more likely to happen again in the future. For example, if a child whines, behavior, and their parent immediately stops nagging them, unpleasant stimulus removed, the child is more likely to whine in the future because whining successfully removed the nagging. Or taking aspirin, behavior, removes a headache, unpleasant stimulus removed, making you more likely to take aspirin when you have a headache. It's about removing something bad to make a behavior happen more often. Question 47. What is the difference between positive punishment and negative punishment? A. Positive punishment adds something unpleasant, negative punishment removes something pleasant. B. Positive punishment removes something pleasant, negative punishment adds something unpleasant. C. Positive punishment increases behavior, negative punishment decreases behavior. D. Positive punishment is used for positive behaviors, negative punishment for negative behaviors. Answer: A. Positive punishment adds something unpleasant, negative punishment removes something pleasant. This question asks about the two types of punishment. Both decrease the future likelihood of a behavior. Positive means adding something. So, positive punishment adds something unpleasant, like a reprimand or an aversive sound, which decreases the behavior. Negative means taking something away. So, negative punishment removes something pleasant, like taking away a toy or losing free time, which decreases the behavior. Option C is incorrect because both decrease behavior. Option D is incorrect. Punishment is applied to behaviors we want to decrease, regardless of how they are labeled. Positive punishment adds bad, negative punishment takes away good. Question 48. What is a motivating operation, MO? A. A consequence that increases the likelihood of a behavior. B. An instruction given by the RBT. C. Something that changes the value of a reinforcer and affects the likelihood of behaviors that have been reinforced by that reinforcer. D. A behavior that is being targeted for change. Answer: C. Something that changes the value of a reinforcer and affects the likelihood of behaviors that have been reinforced by that reinforcer. This question asks about motivating operations, MOs. MOs are things that happen before a behavior, like antecedents, but they have two effects. They change how much you want something, the value of a reinforcer, and they make behaviors that got you that thing in the past more or less likely right now. For example, if you are very thirsty, water becomes a powerful reinforcer, value increases, and you are more likely to ask for water, behavior increases. Hunger, thirst, deprivation, not having something for a while, are examples of MOs that make related reinforcers more valuable and related behaviors more likely. MOs make you want things more or less. Question 49. When is it appropriate for an RBT to physically prompt a client? A. Anytime the client doesn't immediately follow an instruction. B. Only if it is specifically written and required in the behavior plan and they are trained to do so. C. Whenever the RBT thinks it might help the client. D. Never. RBTs should not touch clients. Answer: B. Only if it is specifically written and required in the behavior plan and they are trained to do so. This question is about the safe and ethical use of physical prompts. Physical prompts, especially full physical guidance, should only be used if they are a planned part of the intervention, clearly outlined in the client's behavior plan, and the RBT has been specifically trained on how to implement them correctly and safely. Using physical prompts without proper planning and training can be unsafe and is not best practice. Always follow the plan and ensure you are trained for any physical interventions. Stick to the plan and your training. Question 50. What is a skill acquisition plan? A. A plan to decrease challenging behaviors. B. A written plan that describes how to teach a specific skill. C. A report summarizing client progress. D. A list of the client's favorite toys. Answer: B. A written plan that describes how to teach a specific skill. This question asks about skill acquisition plans. Skill acquisition means learning or acquiring new skills. So, a skill acquisition plan is a detailed set of instructions on how to teach a specific skill to the client. It will outline the goal, the materials needed, the steps to teach, prompting strategies, reinforcement procedures, and data collection methods. These plans are designed by the BCBA/BCABA and implemented by the RBT. It's your guidebook for teaching. Question 51. What is the purpose of baseline data? A. To show the client's progress after intervention has started. B. To get a measure of the behavior before intervention starts. C. To determine the function of the behavior. D. To identify potential reinforcers. Answer: B. To get a measure of the behavior before intervention starts. This question is about baseline data, which is collected at the beginning of a program. Baseline means the starting point. Baseline data gives us a picture of how often, how long, or how intensely a behavior or skill is occurring before we begin any intervention. This is important because it gives us something to compare our intervention data to, showing whether our plan is having an effect. Without baseline data, we wouldn't know if the behavior changed because of what we did. It's the starting point for comparison. Question 52. When should an RBT seek clinical direction from their supervisor? A. Only during scheduled supervision meetings. B. When they are unsure about a procedure, the client's behavior changes significantly, or they have any concerns. C. Only when a behavior emergency occurs. D. Only if the supervisor asks them to. Answer: B. When they are unsure about a procedure, the client's behavior changes significantly, or they have any concerns. This question is about when to reach out to your supervisor. Supervision isn't just for scheduled meetings. Your supervisor is there to guide you whenever you need help or encounter something unexpected. If you are unsure how to run a program, if a behavior gets worse or changes dramatically, or if anything about the client's progress or well-being concerns you, you should contact your supervisor as soon as possible. They are your resource and support. Don't hesitate to ask for help when you need it. Question 53. What is a token economy? A. Giving a client a preferred item immediately after a correct response. B. A system where clients earn generalized conditioned reinforcers, tokens, for specific behaviors, which can later be exchanged for backup reinforcers. C. Ignoring a behavior to decrease its frequency. D. Providing physical guidance to help a client complete a task. Answer: B. A system where clients earn generalized conditioned reinforcers, tokens, for specific behaviors, which can later be exchanged for backup reinforcers. This question describes a token economy, a widely used reinforcement system. In a token economy, clients earn points, stickers, check marks, or other tokens, generalized conditioned reinforcers, for displaying target behaviors. These tokens don't have value on their own but can be traded in later for things the client really wants, backup reinforcers, like toys, free time, snacks. It's like a mini economy where they earn money, tokens, to buy things they like. It helps bridge the gap between the behavior and the larger reward. Earn tokens, trade for cool stuff. Question 54. What is the main difference between reinforcement and punishment? A. Reinforcement adds something, punishment takes something away. B. Reinforcement increases behavior, punishment decreases behavior. C. Reinforcement is used for good behavior, punishment for bad behavior. D. Reinforcement is always positive, punishment is always negative. Answer: B. Reinforcement increases behavior, punishment decreases behavior. This question focuses on the fundamental difference between reinforcement and punishment. The core distinction lies in their effect on future behavior. Reinforcement, whether positive or negative, always increases the future likelihood of the behavior it follows. Punishment, whether positive or negative, always decreases the future likelihood of the behavior it follows. The terms positive and negative refer to adding or taking away a stimulus, not whether something is good or bad, and these processes can apply to any behavior. Reinforcement makes behavior stronger, punishment makes it weaker. Question 55. Which type of data collection would you use to measure how many times a child hits their head? A. Duration. B. Frequency. C. Partial interval recording. D. Momentary time sampling. Answer: B. Frequency. This question asks which measurement method is best for a specific behavior. Head hitting is typically a behavior you want to count each time it happens. Frequency is simply counting how many times a behavior occurs within a specific observation period. Duration would measure how long each hit lasts, usually milliseconds, not very useful. Interval methods give estimates rather than exact counts, which is important for behaviors like head hitting where an exact count is often needed for safety tracking and analysis. You need to know the exact count for behaviors of concern. Question 56. When a client is learning to follow an instruction, providing the instruction is the A. Behavior. B. Consequence. C. Antecedent. D. Reinforcer. Answer: C. Antecedent. This question uses the ABC model again. An antecedent is what happens immediately before a behavior. In this scenario, the instruction given by the RBT happens right before the client's response, the behavior. Consequences happen after the behavior. The reinforcer is a type of consequence. So, the instruction is the cue that sets the stage for the behavior. Antecedent is the trigger. Question 57. Which type of chaining involves teaching the first step of a task analysis, then the first two steps, then the first three, and so on, until the client can do all steps? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer: A. Forward chaining. This question describes forward chaining. In forward chaining, you start by teaching the very first step of the task analysis. Once the client can do step 1 independently, you teach step 1 and step 2 together. Once they can do those, you teach steps 1, 2, and 3, and so on, working your way through the chain from the beginning. Backward chaining teaches from the end, and total task teaches all steps at once. Forward chaining is about starting at the beginning of the sequence. Question 58. What is the primary reason for using differential reinforcement? A. To punish inappropriate behavior. B. To reinforce one behavior while withholding reinforcement for another. C. To reinforce every instance of a target behavior. D. To teach a new skill by breaking it into steps. Answer: B. To reinforce one behavior while withholding reinforcement for another. This question asks about differential reinforcement, which is a powerful behavior change procedure. Differential means different. In differential reinforcement, you reinforce, reward, the behavior you want to see while simultaneously putting the behavior you don't want to see on extinction, withholding reinforcement. There are different types, like DRA, reinforcing an alternative behavior, or DRO, reinforcing any behavior except the problem behavior. The core idea is reinforcing one thing while not reinforcing another. It's like putting one behavior on a rewards program and another on a no rewards program. Question 59. What is prompt fading? A. Gradually increasing the amount of help given to a client. B. Immediately removing all prompts once a behavior occurs. C. Gradually reducing the amount of help given to a client as they become more independent. D. Only using physical prompts to teach new skills. Answer: C. Gradually reducing the amount of help given to a client as they become more independent. This question is about prompt fading, which is essential for promoting independence. Fading means gradually disappearing. Prompt fading is the process of slowly reducing the level of assistance, prompts, you give a client as they start to learn and perform the skill more independently. The goal is for the client to eventually be able to do the skill or behavior when given the instruction without needing any prompts. You start with more help and gradually use less and less. Help them succeed, then back off the help. Question 60. Which term describes a schedule of reinforcement where a fixed number of responses must occur before reinforcement is delivered? A. Fixed interval, FI. B. Variable interval, 6. C. Fixed ratio, FR. D. Variable ratio, VR. Answer, C. Fixed ratio, FR. This question is about schedules of reinforcement, specifically a ratio schedule that is fixed. A ratio schedule is based on the number of responses. Fixed means the number stays the same each time. So, a fixed ratio, FR, schedule delivers reinforcement after a set, unchanging number of responses. For example, an FR10 schedule means reinforcement is delivered after exactly 10 responses. A typical example is earning $1 for every 10 envelopes you stuff. Fixed ratio means a specific number of actions earns the reward. Question 61. What is the best way for an RBT to maintain professional competence? A. Relying only on their initial RBT training. B. Avoiding supervision and trying new techniques independently. C. Attending ongoing training, seeking supervision, and staying updated on best practices. D. Only working with clients they feel are easy to manage. Answer, C. Attending ongoing training, seeking supervision, and staying updated on best practices. This question is about the RBT's ethical responsibility to maintain professional competence. The field of ABA is always evolving, and client needs vary. An RBT must commit to lifelong learning and professional growth. This means participating in ongoing training opportunities, actively engaging in supervision to learn from experienced professionals, and keeping up with current research and best practices. You can't just stop learning after your initial certification. Staying competent means staying curious and connected to your supervisor and the field. Question 62. When observing a behavior, documenting everything that happens before, during, and after the behavior is called A. Frequency recording. B. Task analysis. C. ABC data collection. D. Preference assessment. Answer, C. ABC data collection. This question describes ABC data collection, which is a fundamental tool for understanding behavior. ABC stands for antecedent, what happened right before the behavior, what the person did, and consequence, what happened right after the behavior. Collecting this information helps the BCBA analyze the pattern of the behavior and determine its function, why it's happening. It's a detailed way to capture the context of the behavior. ABC data tells the story of the behavior. Question 63. What should be included in an RBT's session notes? A. Personal opinions about the client or family. B. Subjective descriptions like, the client was bad today. C. Objective, observable information about what happened, what was worked on, data collected, and any incidents. D. Information about other clients. Answer, C. Objective, observable information about what happened, what was worked on, data collected, and any incidents. This question is about writing professional and effective session notes. Session notes are a record of what happened during the therapy session. They must be objective, just the facts, what you saw/heard, based on observable information, and include details like what programs were run, the data collected, any significant behaviors, both target behaviors and challenging behaviors, and any important incidents. They should not include personal opinions, subjective judgments, or information about other clients. Write down what you saw and did, like a factual report. Question 64. What is shaping used for? A. To reduce a challenging behavior. B. To teach a completely new behavior that the client doesn't currently do. C. To maintain a skill the client already knows. D. To identify preferred items. Answer: B. To teach a completely new behavior that the client doesn't currently do. This question asks about the purpose of shaping. As discussed before, question 25, shaping is used to teach behaviors that are not currently in the client's repertoire, behaviors they can't do independently yet. By reinforcing successive approximations, closer and closer steps, you gradually shape the client's existing behavior into the desired new behavior. It's a method for building new skills from scratch. Question 65. When implementing a prompt, which prompt level is the most intrusive, provides the most help? A. Vocal prompt. B. Gestural prompt. C. Independent. D. Full physical prompt. Answer: D. Full physical prompt. This question asks about prompt hierarchies and which prompt gives the most help. Most intrusive means the one that involves the most direct assistance. Full physical prompt, where you guide the client's body through the entire movement, provides the maximum amount of help and is considered the most intrusive. Vocal and gestural prompts provide less help. Independent means no prompt is needed. Generally, we try to use the least intrusive prompt necessary to help the client respond correctly, to encourage independence. Question 66. What is the ultimate goal of prompt fading? A. To always provide the least intrusive prompt possible. B. For the client to perform the skill independently in response to the natural SD. C. To eliminate all reinforcement. D. To make therapy sessions shorter. Answer: B. For the client to perform the skill independently in response to the natural SD. This question asks about the main purpose of prompt fading. The ultimate goal of fading prompts is for the client to learn the skill so well that they can do it correctly when the instruction, the natural SD, is given, without needing any extra help. You fade prompts so the client can become independent. While using the least intrusive prompt is a good practice during the process, the final goal is independence. The goal is for them to do it themselves. Question 67. If a behavior occurs repeatedly because it allows the client to escape a demand or situation they dislike, what is the likely function of that behavior? A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer: C. Escape. This question is asking about the possible functions, reasons, for a challenging behavior based on its consequence. The key phrase is allows the client to escape a demand or situation they dislike. If a behavior happens, and the result is that the client successfully gets away from something unpleasant, like finishing a task or staying in a room, the function is likely escape or avoidance. They are using the behavior to get out of something. Attention is seeking interaction, access is getting an item/activity, and automatic is internal sensation. If the behavior helps them get away, it's probably escape. Question 68. What is the difference between a trial and a session? A. A trial is a single instance of presenting an SD, getting a response, and providing a consequence. A session is the entire time you are working with the client. B. A trial is only used in DTT, while a session is used in natural environment teaching. C. There is no difference, the terms are interchangeable. D. A session is shorter than a trial. Answer: A. A trial is a single instance of presenting an SD, getting a response, and providing a consequence. A session is the entire time you are working with the client. This question distinguishes between a trial and a session. A trial, often in DTT, is a very small unit, presenting an instruction or cue, SD, the client doing something, response, and you reacting, consequence. A session is the whole period of time you are working with the client, which contains many individual trials or learning opportunities. Think of a trial as one single turn or interaction focused on a specific skill, and a session as the whole block of therapy time. A session is made up of many trials. Question 69. When working with a client, it's important to use reinforcement that is: A. Easy for the RBT to deliver. B. Highly motivating for the client. C. Always food items. D. Given only after many correct responses. Answer: B. Highly motivating for the client. This question is about choosing effective reinforcers. Reinforcement only works if it actually increases the behavior, and for it to do that, it must be something the client values and wants to work for. What is reinforcing is different for everyone. While ease of delivery is practical, the client's motivation is the most critical factor. Not all clients are motivated by food, and sometimes you need to reinforce early and often, especially when first teaching. The reinforcer needs to be powerful for the person you are working with. Find out what lights them up. Question 70. If a client grabs a toy from a peer and is immediately given the toy by the peer's parent to stop the crying, and this makes the client more likely to grab toys in the future, what function is the grabbing serving? A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer: B. Access to tangibles. This question provides a scenario and asks you to identify the behavior's function based on the consequence. The consequence of grabbing, the behavior, is immediately getting the toy, a tangible item. If this consequence increases the future likelihood of grabbing, then the function is access to tangibles. The client is using grabbing as a way to get desired items. Attention would be if grabbing resulted in social interaction, escape if it removed something unpleasant, automatic if the grabbing itself felt good. Getting the item makes it access to tangibles. Question 71. What is a prompt hierarchy? A. A list of all the prompts the RBT can use. B. Ordering prompts from least intrusive to most intrusive, or vice versa. C. A system for deciding when to deliver reinforcement. D. The steps of a task analysis. Answer: B. Ordering prompts from least intrusive to most intrusive, or vice versa. This question asks about a prompt hierarchy. A hierarchy is a ranking or ordering. A prompt hierarchy orders prompts based on the level of assistance they provide, typically from the least intrusive, like a gestural prompt, to the most intrusive, like a full physical prompt. This helps guide the RBT in using prompts systematically and fading them effectively. You might start with more help and move towards less help, most to least, or start with less help and increase only if needed, least to most. It's a step-by-step guide for giving help. Question 72. What is the purpose of implementing a crisis intervention plan? A. To teach new skills. B. To manage immediate safety risks during a severe challenging behavior. C. To collect data on behavior frequency. D. To identify preferred items. Answer: B. To manage immediate safety risks during a severe challenging behavior. This question is about crisis intervention plans. These plans are specifically designed to be used during a crisis, when a client's behavior poses an immediate risk of harm to themselves or others, severe challenging behavior. The primary purpose is to ensure safety and de-escalate the situation, not to teach skills, collect standard data, or find reinforcers. These plans often involve specific, predetermined steps for managing the behavior safely and are developed by the BCBA. Safety first. Question 73. What does generalization across people mean? A. The client uses a skill with different people. B. The client uses a skill in different places. C. The client uses a skill with different materials. D. The client uses different skills with the same person. Answer: A. The client uses a skill with different people. This question breaks down generalization into one of its forms. Generalization means the skill happens beyond the specific teaching situation. Across people means the client can perform the skill when interacting with different individuals, not just the RBT who taught it, but perhaps parents, teachers, siblings, or peers. Generalization across settings is different places, across stimuli/materials is different items. We want skills to be useful with everyone in their life. Question 74. If a client learns to wash their hands in the therapy room sink, and can now also wash their hands in the bathroom sink at home without being retaught, this is an example of A. Discrimination. B. Extinction. C. Generalization across settings. D. Punishment. Answer: C. Generalization across settings. This question provides a specific example of generalization. The client learned the skill in one location, therapy room sink, and can now do it in a different location, bathroom sink at home. This is performing the skill in a new environment, which is generalization across settings. Discrimination would be doing the behavior only in one setting and not others. Extinction is decreasing behavior by removing reinforcement. Punishment decreases behavior. This is a great example of learned skills transferring to new places. Question 75. What is the ethical requirement for RBTs regarding documentation? A. Documentation is optional if the RBT has a good memory. B. Documentation should be completed promptly and accurately. C. Documentation only needs to include positive behaviors. D. Documentation can be completed days or weeks after the session. Answer: B. Documentation should be completed promptly and accurately. This question is about the RBT's ethical responsibility related to documentation. Accurate and timely documentation is crucial for tracking progress, making informed decisions about treatment, and for legal/ethical purposes. RBTs are required to complete documentation, like session notes and data sheets, promptly after the session while details are fresh, and to ensure the information is accurate and objective. Waiting too long can lead to errors. Good documentation means writing it down correctly and quickly.